Welcome back. As we approach the summer season, it's traditional to celebrate the warm weather with outdoor activities, music, and on some occasions, fireworks. But for those living with Alzheimer's, these moments can be overwhelming or stressful. The Dementia Program Director for the MJHS, Dr.Kendra Ray, joins me to discuss solutions, caregiver tips, and the types of events to keep in mind to ensure this summer is enjoyable for everyone. Doctor, thank you so much for joining me.
Thank you so much for having me today.
Now, can you give us a little bit of an overview on the services MJHS offers to those with Alzheimer's?
Yes, thank you so much for having me. I'm so pleased to work for MJHS Health System, which is a not-for-profit located in New York City. We offer an array of services, including MJHS health plans that are elder plan and home first. We also have MJHS hospice and palliative care, home care, and we have two skilled nursing facilities. One of them I work at is MJHS Menorah Center for Rehabilitation and Nursing Care, and our other nursing facility is located not too far from here in Washington Heights. It's MJHS Isabella Center for Rehabilitation and Nursing Care.
Now, I'd love if you could give us the medical definition of Alzheimer's disease, because I know that we hear the term and a lot of people think they know exactly what it is or how people living with Alzheimer's will react. But can you give us, just in your experience, true definition of what that is?
Yes, very simply put, Alzheimer's disease is a neurodegenerative disease, meaning that over time people will lose their memory. It affects both the mind and the body. One thing that people don't necessarily consider is that it not only affects the person who is living with Alzheimer's disease, but also the family unit.
And what are the different stages?
Right, so there are about 3 stages that people usually go through. There's the early stage, the moderate stage, and the late stage. At MJHS Menorah, I work with people who are mostly in the moderate to later stages. That's when they need help with their mobility. Some people have some speech and communication problems, and a lot of them need help getting dressed and with bathing and things like that.
Now, can you tell me more about the role caregivers play in assisting those living with Alzheimer's?
Yes, caregivers play a pivotal role in caring for people who have Alzheimer's disease. Specifically, the professional caregivers where I'm working and family caregivers are responsible for helping prepare their foods, helping them to get dressed, helping them to do creative arts therapies like what I'm involved in and leisure activities. So they're really responsible for helping people have a better quality of life.
Now, when I first found this out, I was really shocked just to hear that, for a lot of people with Alzheimer's, summer can be just an interesting time. I had no idea that, the weather could affect people in this way. So, with that being said, with summer approaching, why is it important for caregivers to think carefully when assisting those with Alzheimer's?
Everybody is so excited to get outdoors and enjoy the warm weather, especially with this beautiful weather we've been having the last few weeks. Some things that caregivers might consider is that socialization is a protective factor for brain health. So we want to think about involving people with Alzheimer's disease and other types of dementia in activities to help them keep active. We know that sometimes people aren't able to get outside, but there are other things that you can do indoors to keep people active.
Now, we'll definitely get into talking about some ways we can keep people active, but with keeping summer in mind, I understand there's something called sundowning, and that is also something that could affect a lot of people living with Alzheimer's. Can you explain what sundowning is?
Yes, so sundowning is a professional and clinical term that many people who are working with people with Alzheimer's disease use. It usually occurs in the evening hours. Where I'm working, we see sundowning around 2 to 3 in the afternoon. That's the time when people start to become a little bit agitated, irritable. For some people, it can be as extreme as, they feel like they want to go home, or, they can't, or they're calling for their family members. So it's a time that we really want to think about, how can I provide some activities to help keep the person calm. And for us, where I'm working, we use music. We use music a lot. If we know that sundowning is going to occur at 2:30 p.m., for example, we'll try to play music for the people at 2 o'clock, so we might avoid those symptoms from occurring.
And I'm curious to know, what is the background in sundowning? Is it just because, it's been a few hours and now people are just maybe exhausted or feeling tired? Is it kind of like just a coincidence that, during this time, this is also when I guess more people are outside? Or are there any underlying factors as to why we're seeing this behavior at this time?
From my clinical experience, it is something that just naturally occurs when a person has Alzheimer's disease or other types of dementia. It's just something, it's one of those symptoms that occur naturally and unfortunately. Not every single person experiences sundowning. There are some people who have agitation a little bit more in the morning time, but for the majority of people, it is something that occurs in the evening.
Now, keeping that in mind, what are some tips you can share for caregivers so their loved ones with dementia can also enjoy summer experiences?
Absolutely. People with dementia can enjoy outdoor and summer activities. And from my clinical experience and from my research experience, I know that if the person with dementia is calm and if they're happy, that the person who is caring for them will have less distress and less burden. So finding activities that reduce stress but produce joy is key. And one way we might think about doing that is, for some people, we know getting outdoors is really difficult. So from the clinical work, I know that playing music in the background while getting dressed in the morning or while brushing your teeth or even during shower time can make things easier as people are trying to transition to outdoors. And just to think about that fireworks or things that might cause noise, you might, before even going outside, prepare the person for the activity. So you can use technology. We all have YouTube, so we can watch fireworks before we get there so that we know what to expect and talk about that noises might be expected during that time. But then if you're thinking about calm activities and keeping the person engaged outdoors, maybe try the outdoor activities in the morning versus in the evening. Avoid crowds, avoid times that are peak experiences, but make sure you have some fun.
Now, with what activities should individuals avoid if they may be impacted by sundowning?
Yes, I think avoiding evening outdoor activities is probably what makes sense. But there is some research that says that exercise is good for reducing agitation. So if you're able to get out and take a walk, that is an option. Or planning to go and watch the sunset, that's an option as well.
Now, I definitely want to take a moment to highlight you and the work that you've done. I understand that you recently presented at a Women's Alzheimer's Movement Symposium. The event was attended by many notable people, including the First Lady of the United States, which is pretty amazing, and Maria Shriver. Could you share your experience and your research and, what was this entire event and experience like for you?
To say it plainly, it was one of the most incredible experiences that I've had and unexpected. Dr. Biden and Maria Shriver both are huge supporters of Alzheimer's research and women's health research. As a matter of fact, Maria Shriver's Women's Alzheimer's Movement funded my study on music and caregivers and music for people with dementia. So I was really excited to attend this event with other researchers to be able to present some of my preliminary findings. So I was able to present my research to Maria Shriver and also to Dr. Biden. It was a phenomenal experience for me.
And I also want to highlight, I know that you talked about, just the power of music and the arts. Can you just, take a moment to explain, how that has impacted the work and how you're able to care for people living with Alzheimer's?
Absolutely. I think that a lot of times people think that once they have a diagnosis, that it's over and that they can't be active in their communities or active just, personally. But we found that many people, even with the diagnosis of Alzheimer's, can still play the piano. They can still sing their favorite songs. Many who didn't know that they were artists now are very, very creative. And so we try on a daily basis to engage people in the arts so that they can have meaning and purpose in their lives.
And have you also seen, the arts create a sense of community? Because this is something that everyone enjoys regardless of, your background in health. So can you talk about what you've seen and how it's been able to foster community?
Yes. On a daily basis, because we do offer music therapy and art programming and other creative arts, family members usually flock to our sessions because they also want to engage in those types of activities. So we are able to also collaborate with schools like other CUNYs, like Kingsborough Community College. We work with their students, and they come and they assist us in our activities as well. So the creative arts, actually, you're right, it does help to create a sense of community, and people can do it regardless of whether or not they have Alzheimer's disease or not.
Now, lastly, what's your message to professional caregivers, including many new graduates entering the field now, about how to adapt if an activity isn't going as planned?
I think graduation has just occurred here at Lehman College, so congratulations to all of the graduates. Just know that MJHS.org does have many positions available for those who are in the caring field. But the message that I would give to those who are caring for people with dementia and Alzheimer's disease is to know that if you try something the first time and it doesn't work, it's okay, you can try again. But then also know that there are resources that are available to you, like Caring Kind, the Alzheimer's Association. We have a booklet called MJHS Keys to Dementia Care that is downloadable. So think about how you can engage with other organizations and other resources as you are engaging people with Alzheimer's.
Well, Doctor, I want to thank you so much for joining us and having this, really important conversation, and honestly talking about ways that we can still continue to do the things we love. There's always a solution to do the things that we love with the people we love, despite the fact that they may be living with Alzheimer's. I think that's amazing. So thank you so much for joining us and having this conversation.
Well, thank you.
To learn more about the services they offer, please go to their website at mjhs.org. Stay tuned. We have more for you right after this.